our son battled with Steven Johnson syndrome slash TENS, which is toxic epidermal necrolysis, if I got the pronunciation right.
That small rash could be your body screaming for help. Please don't scroll past this video. But before we dive in properly, listen to this.
What started as a blister or a rash on his body as a result of an anti-malaria medication that he used, all we did was to get a medication, anti-malaria medication for him from a pharmacy after running a test for him. And the pharmacist gave us fancier, told us to use 3 tablets for him. By the way, our son is 7 years old, but the truth is that this has been the hardest and the scariest part of our lives. I didn't understand how a medication that was supposed to treat malaria for our son would turn out burning him internally and outside, shutting his 2 eyes, his mouth, couldn't talk.
The young boy had Steven Johnson syndrome after taking anti-malaria medication. Steven Johnson syndrome is a rare but life-threatening reaction, most often triggered by medication. This condition is a medical emergency. It may start like the flu, then quickly turn into severe rashes, blisters, and peeling the skin. This Steven Johnson syndrome can sometimes be triggered by sulfur-containing medication, such as antibiotic like Septorin, anti-malaria like Fancida, and some other sulfur-containing medication. The first one is the skin. It will cause severe blistering, peeling, infection, and scarring to the skin. It can affect the eye. I've seen a patient that got blind because of this condition. It can also affect mouth and throat. Other organs it could affect is the lung, kidney, liver, genital and urinary tract, and in severe occasion, it can affect the bloodstream. This is one of the reasons self-medication is risky. When you take medication without doctor's advice, you don't know how your body will react. Some reaction might be mild, while some might be severe. Like, there are the early warning signs you should never ignore: fever, sore throat, and body aches, red or purple rash that spreads all over the body, blisters on skin, lip, eye, or private area. Lastly, burning or difficulty in swallowing. What should you do when this thing happens? If symptoms start immediately after a medication, stop the medication immediately and go to the hospital. Let's keep looking out for each other. Share and follow this page for more quick health nuggets you can actually use. Bye.